Okay, so here we go with part two, week 4. This is our case for the week. Ever wonder why Batman never seems to age? I mean, he's like always 25 with great pecs and all that sort of stuff. Well, in reality, he does age. In fact, this is what he looks like today. Um, Bruce Wayne as an old man. So, Bruce is 80 and he comes into your clinic and he's got pain in his right shoulder, under his cape there, losing range of motion. He's retired. Spends most of his time playing checkers with Alfred, his 141-year-old butler. Batman said 9 months ago he noticed his right shoulder starting to stiffen up and hurt, especially at night. So it was a progressive kind of thing. Kind of came out of nowhere, starting to stiffen up. Didn't have any trauma or anything. Just for some reason his shoulder started to stiffen up. In the last few weeks, however, he said his shoulder started to move some, but it's still very painful. So he's starting to get some of his motion back. It strangely got stiff, and now it's strangely starting to loosen up. He still has good strength in his shoulder, and passive range of motion in his shoulder is the same as active range of motion. This doesn't mean much to you now, but it's a key clue as to what is going on in his shoulder. His goal is to get back to his shoulder back so he can dress himself. Alfred currently helps him dress, which he finds extremely humiliating, and beat Alfred playing checkers with his right hand. How can we help Batman? What stage of frozen shoulder? That's one of the things we're going to tackle today. Do you think he's at? Will they ever stop making Batman movies? Okay, so let's just look at arthritic shoulders. This is a good healthy shoulder. This is not so much a healthy shoulder. Everything just kind of falls apart. Erodes the cartilage. Arthritis really destroys it in there. You will see a ton of arthritic shoulders in your career in nursing homes and hospitals, outpatient rehab, home health. It's very, very common. People get arthritis in their shoulder, starts to swell, deteriorate, and it can eventually start to look like this. There's just not much left in there. What's the thing that jumps out at you with this? To me, it's decreased joint space. Here we go again. Space. They've lost space. There's no buffer at all. It's just jammed. It's jammed up into that fossa right there. So that means they're going to lose motion. It's going to be very painful. It's going to be grinding bone on bone. And when it is bone on bone, something that happens is the shoulder starts to get bone spurs. Just the stress of the bone on bone causes these spurs to grow. What are bone spurs? Little bumpy nodules. So they would start to formulate right in the fossa in there. The shoulder surgery I saw where they were cleaning it out and repairing the supraspinatus. He also went in there at the time and he cleaned out the spurs. He took a knife literally and just scraped them out of there. Why did he do that? To improve the space and flow in that shoulder joint so it could move better. Supraspinatus goes right over here, and he was also stitching that out. So this is kind of what it looks like end-stage arthritic shoulder. And if it gets so bad in terms of the pain and the loss of motion, something they're doing more and more often, more commonly, is they're replacing the shoulder. There's different kinds of shoulder replacement. It's good to know the 3 basic types of shoulder replacement. Something called hemiarthroplasty. It's not a full shoulder replacement. As you can see in a nice clear image, they're just replacing the humeral head. This is all deteriorated, so they're just replacing this. This shoulder looks pretty intact, pretty healthy, except for probably the deterioration here, and they just kind of scrape it off and just hammer that sucker right in there, and they do literally hammer it in, pound it into the top of the humerus there. So that's a hemiarthroplasty for a fracture. And then we have the other 2 common shoulder replacements. You may be familiar with these. There's the traditional total shoulder replacement. These are total shoulder replacements. And there's something called a reverse total shoulder replacement, a newer surgery that they're doing. The total shoulder arthroplasty, they drive this down into the humeral head. This big bulb becomes the humeral head, and this becomes the fossa, this thing that they drive in on this side. It's like a whole new shoulder. What's good about these in terms of, especially in terms of the outcomes, how much motion they get back, is usually the rotator cuff is still intact when they're doing this. They've just lost motion, pain, so they need to replace it. But the rotator cuff is still working, or they can fix it so it's still pretty much intact. With these guys, these newer total reverse shoulder replacements, rotator cuff is no longer intact. They're not going to have much rotation at all. They're not going to have much movement really at all. This is a lot. To me, the big thing for this is pain relief. In terms of rehab recovery, regaining their motion, there really is not good outcomes for these. They call it reverse because they're just kind of flipping that around, putting this part here and that part down there. A lot more involved surgery. For older folks, we're usually the ones that get this. The outcomes generally are not good in terms of motion, getting their motion back. With osteoarthritis, total shoulder replacements are effective. Most patients, most of these patients should expect to achieve acceptable functional range of motion, defined as 140 degrees of forward flexion. You get that? They're doing pretty good functionally. So these are pretty much intact shoulders. They have some arthritis. The rotator cuff is probably intact. Rheumatoid arthritis, not so much. There's a lot more deterioration, a lot more involved surgery. It does help with pain relief, but they really don't regain that range of motion. If you can get them to 90 degrees, halfway up, you're doing pretty good with these kinds of patients, generally speaking, based on the research. Talk about the rotator cuff. They lost the rotator cuff. It's too torn. They can't repair it. There's too much damage in there. They do that total shoulder replacement or reverse shoulder replacement. The outcomes are not good in terms of gaining motion back. Proximal humeral fractures, it depends on how involved the fracture is, how many parts it is. Again, not great outcomes with that, especially if the rotator cuff is involved. So you're getting a mixed bag with these. What I saw in the clinic, probably a little bit better now, but I just knew someone had one and they didn't get good return either. Older folks with involved shoulders, it's mostly pain relief. It's not like a total knee or a total hip where they can get all that motion back and really get a lot of function back. It's more kind of pain relief. At times I wonder why they're doing it, because it doesn't seem to accomplish a lot, to be honest. Okay, so that is the end of that.